Have you ever wondered if our bodies could send out signals when something's wrong? Kind of like smoke signals, but on a molecular level? Well, in a way, they can. That's pretty much what tumor markers are, these tiny biological clues that can hint at what's going on deep inside of us. Today, we're going to unlock their secrets. So here's our game plan. We'll start with the big idea, what these markers even are. Then we'll get into how we actually find them and what their real mission is in cancer care. After that, we'll look at some really specific examples you've probably heard of. And finally, we'll cover the super important caveats. All right, let's dive right in. First up, the big idea. What exactly are we talking about when we say the words tumor marker? Okay, so a tumor marker is not the cancer itself. That's the first thing to get straight. It's actually a substance, usually a protein, that's made either by the tumor or, and this is key, by your own body in response to the tumor. These signals can then be picked up in your blood, your urine, or in a tissue sample, giving doctors a really vital piece of the puzzle. Now, in a perfect world, what would the perfect tumor marker look like? Well, scientists have this kind of dream checklist. It would be super specific, pointing to just one type of cancer. It'd be incredibly sensitive, meaning 0 false positives. It would show up really early, and its levels would go up and down perfectly with the size of the tumor. Oh, and of course, the test would be cheap and easy. That's the gold standard they're always chasing. But here's the reality check. That ideal, perfect tumor marker, it just doesn't exist. Not yet, anyway. And you know what? Understanding that one simple fact is the absolute key to understanding how they're used in the real world. So if these little signals are floating around in the body, how do we actually find them? Let's get into the pretty clever lab techniques that scientists use to hunt them down. One of the workhorses is a technique called immunohistochemistry, or IHC for short. This is for tissue samples. Think of it like this. You have an antibody that's like a special key, and it's designed to fit only one specific lock. That's the marker protein on a cell. When that key finds its lock, it triggers a stain, basically lighting up the target so pathologists can see it under a microscope. It's pretty cool stuff. But that's for solid tissue. What about liquids, like your blood? For that, there's another really powerful tool in the toolbox called ELISA. The way ELISA works is just brilliant. People often call it a molecular sandwich. You start with antibodies that grab onto the specific marker you're looking for in the patient's sample. Then, a second antibody comes in and latches on too, creating the sandwich. This second one has an enzyme attached. Finally, you add a chemical that makes that enzyme change color. And here's the magic. The darker the color, the more marker there is. And you can see the whole process right here. It shows how it goes from just a sample to that final color-coded result that gives doctors a number. It's an incredibly sensitive and precise way to measure these things. Okay, so we know what they are and we know how to find them, but what's their actual mission? What do they do to help doctors and patients when it comes to cancer care? Their role is actually way bigger than just diagnosis. They are vital tools for managing the whole journey. Doctors use them to help figure out the stage of a cancer, to see if a particular treatment is actually working, and, this is a huge one, to detect if a cancer has come back, sometimes way before it would ever show up on a scan. All right, let's move from the general to the specific, because this is where the science gets really personal. We're going to look at some of the most common tumor markers out there, including ones that are really important for men and for women. So while some markers are pretty universal, others are tied to cancers that mainly affect men or women. So let's dive into some key examples, and we'll start with women's health. For women's health, there are a few you've almost definitely heard of. First, BRCA1 and BRCA2. Now, these are a little different. They're actually gene mutations that indicate a much higher risk for breast and ovarian cancer. For ovarian cancer specifically, a protein called CA125 is a major player, often used to see how well a treatment is working. Then there's HR2/NU. This one's a big deal in breast cancer. If a tumor is HER2 positive, it means there are specific targeted drugs that can be used. And finally, CA15-3 is a real workhorse for monitoring patients after breast cancer treatment to watch for any recurrence. Now for men's health, the most famous one by far is PSA, which stands for prostate-specific antigen. It has its issues, but it's still incredibly important for diagnosing and monitoring prostate cancer. For testicular cancer, doctors lean heavily on two markers, AFP and HCG. In fact, their levels are so critical they're actually built into the official staging system for the disease. And another one for prostate cancer, PAP can be helpful to see if the cancer may have spread. Of course, it's not all gender-specific. lots of critical markers apply to everyone. This table gives you a wider view. You've got CEA, which is really important for tracking colorectal cancer, and CA19-9, which is a key marker for pancreatic cancer. It's a huge, constantly growing field of study.
Okay, we need to pause here for a second because this next point is probably the most important one of all. These markers are amazing tools, but they are not perfect. We absolutely have to talk about the fine print, the limitations.
And that brings up the big question, right? With all this amazing tech, why aren't we just using these tests to screen everybody for cancer all the time? Well, the answer, at least right now, is a firm no. And there are two big reasons. First, they lack specificity. That means other non-cancerous conditions can make the levels go up. A high PSA, for instance, could just be a simple infection. Second, they can lack sensitivity. That means someone can have cancer, but their marker levels are totally normal. And that's why their real power isn't in screening the general public, but in watching patients who are already diagnosed or people who are known to be at very high risk.
But science is always moving forward. The field is quickly shifting from just tumor markers to what's called biomarker testing. This is the future, right here. It's about looking beyond just one substance to analyze the entire unique genetic and molecular signature of a person's individual cancer. And that allows for treatments that are custom-tailored to them.
And that really leads us to the final thought I want to leave you with. As our ability to read these incredibly complex biological signatures gets better and better, how is that going to completely change the face of personalized medicine as we know it? Follow, like, and share BioDojo videos.